Are some AF patients also can prove difficult to rate control or don't tolerate the rate controlling medications very well? Firstly, can you tell us about the dangers of AF patients not being adequately rate controlled? And can you give us any cutoffs? Are these also patients that you would like to see for consideration of a catheter ablation?
So one of the long-term sequelae of atrial fibrillation is the development of heart failure. And the heart failure is related to a large extent on the controlled or the uncontrolled ventricular rates. So sometimes patients with atrial fibrillation tend to run ventricular rates of 110, 120 beats per minute at rest, which quickly goes up to 150, 160 beats per minute on relatively minimal exertion. And over time, those kind of rates will result in deterioration of left ventricular function and heart failure. And hence the reason why, if you do manage somebody with rate control, you have to make sure that it is effective rate control. And by effective rate control, we mean a resting heart rate of less than 100 beats per minute at the very most. So what I tend to do is, if I have a patient who comes to me in clinic, I would do an ECG, and if the resting heart rate is 90 beats per minute, I might make them do a little bit of exercise by just walking up and down the room, and then just checking their pulse again to make sure that it hasn't shot up to 130, 140 beats per minute. It's a very simple test you can do. So resting heart rate less than 100 and a heart rate on minimal exertion of no more than 120 would perhaps be a useful marker for us to look at. If you get faster rates than that, then there is a higher likelihood of developing so-called tachycardiomyopathy.